And if not, why do you ask us as a community to give you $3 million? Not willing to give it when a local bank, a local institution will not even do $1 million.
You're correct. NBT or any other bank in any county would look at the numbers and take a look at it. NBT does actually have a loan to St. Mark's for some of the HUD guaranteed bonds. They needed some specific numbers, but it was fully collateralized by a CD pledge from the foundation.
And my last thing, and I'm going to pass it off, there's a lot of people here I know that work for the hospital, and there's been a lot of things on social media that were rude, mean, crude, heartless because we don't want this. I mean, I've got friends over there that I don't shake their hands, I hug them. I don't want none of them to lose their jobs. And I'm looking, we have little rent houses where we pay the mortgage by, the rent pays the mortgage, insurance, and taxes. We don't make a penny. Actually, you can ask my wife, we have somewhere we lose money. We can't. So we have good renters, good people. Well, let me ask you this, why am I going to have to raise the rent due to somebody else's negligence?
And the only thing I would say to that, Michael, with all due respect, is that 23 hospitals, rural hospitals have closed in the state of Texas. I don't think you can say that there was negligence for all 23. I know for a fact that my service on the foundation has been in support of the hospital for 20 years now. I've only been on the board for the last 2 years and 4 months. But I've seen nothing close to negligence in any way, shape, or form. It was Affordable Care Act, Medicaid, Medicare reduction. The great state of Texas decided not to expand Medicaid. Insurance companies cut back. So it was a combination of things.
I think Gene Aiding has another question there, Michael.
Yes, I'm very familiar with the hospital. Obviously, I served on the board of directors there for a number of years. That's not the question that I have. The question, this is a city, and it was turned into a city and a county hospital. Giddings and Lee County has kind of been washed away, seems like. I know they still participate a little bit, but my question is, and this is discounting a hospital district being formed, has the board or council attempted to talk to the city of LaGrange and also to the Fayette County whether they have any surplus, and probably not, or they'll tell you not probably, but I think that we need to make an effort to see whether the city of LaGrange and Fayette County will step up and help the situation. They need to be the leaders in this, and they also need to take the facts that it's going to be a plus for our county. It's going to be a plus for our city if we get some funding from the city and the county. I don't know their finances, but I would appreciate the board checking into that.
Mayor Murphy, did you bring the city checkbook with you? You guys want to address the possibilities of looking into the city and county helping out financially?
One thing that I would just say, just in my experience with the rural hospitals and hospital districts, I mean, typically there aren't too many city-county owned hospitals anymore. And if the county, if they did have a surplus and were willing to give that'd be great. My guess is there probably isn't. And also, if the county were to take it back over somehow, you could almost guarantee that the tax rate from the county would have to go up to take care of, to increase. So, I think it's, one way or the other, if you want a community hospital, then it's going to have some sort of tax relief help.
Gene, nobody's going to write a check to Community Hospital Corporation. Community Hospital Corporation controls the St. Mark's bank account. Money comes in. Hey, wait a minute. I'm owed more money. I'm owed more consulting fees. Too many animals at the trough. If we knew that the hospital was going to get full benefit of that money is a different situation than not knowing what consulting fees, what other expenses may come forward saying, hey, we're owed this. And so the money disappears in a black hole. And you're no better off than you were before the effort was. Now, if St. Mark's could again become independent, then you know what you're dealing with. You know where the money goes. You go look at the books. You can ask questions. Thank you.
And we do have, both Fayette and Lee County do give money to help offset some of the costs. We're talking tens of thousands, each year. So it does get from both Fayette and Lee.
Mr. Weed, right after you finished your comments, somebody made a remark over here. We didn't hire CHC. Do you want to address that?
No, we didn't. But they possess and control St. Mark's Medical Center, its board of directors, and every function which it exercises. The board of directors in December of 2010.
Yeah, I was not on the board at the time, but it was, the previous board did look into different groups to help, and that's who they ultimately came out of. I'll just make a comment. Again, we're all worried about transparency. Some of these other bigger corporations take over, all that's going to go away.
And how many CHCs, how many hospitals do CHCs overlook in Texas?
Yeah.
In their statements in their website, they claim connection with, the number varies, but about 20 institutions.
How many of them are failing?
I don't know. Independent reporting services with copyright information that I've purchased says that Community Hospital Corporation is in a big bind.
Basically, we have no checks and balances in this operation.
They own the farm.
Yes, sir.
Yes, my name is Gary Antosh, and I'm a lifelong resident of Fayette County. And I just have a few comments. I guess in the last 20, 25 years, we've gone from a hospital like Fayette Memorial Hospital with no debt, some fine employees, and doing a lot of good deeds for the people in Grange and Fayette County, to now what we have, St. Mark's Hospital. From 1985 to 2000, there were many, many rural hospital closings already that happened in the state of Texas. To me, that should have been a bunch of red flags. Like, what's going on? I mean, times have changed. There's been a lot more to outpatient services, and the next generation of people, just like me, we're all eating better and exercising, and we don't want to spend time in a hospital bed. You know, when you talk about spending $30 million, you know, the due diligence process for that should have been looking out 20 to 50 years. St. Mark's was not even 10 years and already had issues. So, I mean, there were some false accusations there. There was a lot of false due diligence that was done to go ahead and dig that first shovelful of dirt to start St. Mark's. I mean, there's a lot of competition out there. I called Smithfield Hospital. If you look on their website, they're welcoming all Bastrop, all Lee County, and all Fayette County citizens. Come to us. We'll help you out. You know, as an entrepreneur, this young gentleman here talked about being an entrepreneur. There's one thing I think all business people have to understand. And Coca-Cola Bottling Company was there's an employee that had an individual that said, we have to earn our right to do business with our customers every day. If we don't do that, you won't succeed. I guess my question is, how are you going to compete with places like Smithfield and all these other institutions that are really taking a really proactive approach to health care for all these citizens in Fayette and surrounding counties? Thank you.
This gentleman, this Mr. CEO, you want to address that, please?
Sure. Smithville has about 2 patients a day on average. We get ambulance transfers from their ER frequently. So I wouldn't hold Smithville out to be the high bastion of modern healthcare, because they're not. A lot of their, and that's not true. We compete with them very well. You can ask Dr. Juneau. Columbus, all of our physicians are board certified. All of our active medical staff are board certified physicians. You don't find that in any other rural hospital that I'm aware of. So, and Smithville physicians aren't board certified. Bastrop could be a different issue, but that's a micro hospital, 6 beds. It's a micro hospital. Seton Ascension uses Smithville to transfer their patients into Austin. They're going to use Bastrop to do the same thing. So I'm not concerned about competing with Smithville, because I don't consider Smithville to be a competitor.
I'm going to let Dr. Juneau wrap that up, that portion there, comparison, if you would, Doctor, and then we're going to have closing statements and wrap it up this evening. So if you want to just kind of dovetail on those comments.
Yes, so Smithville is just on a management agreement with Seton and Ascension. So when we talk about CHC and you think about Smithville, Seton is their CHC. The new hospital, though, is fully owned by them. Yes, I would say, yeah, they have a census of about 2. There's no surgical staff on call for them, so they don't have any general surgical operative stuff. There is one gastroenterologist who I have to back up and see a bunch of his patients, who does endoscopy out there. But they have no other those surgical. I mean, so the patients they're keeping in there are nursing home type patients, something simple like that. Anything else is being transferred out.
Okay, we're going to have closing statements now. Ms. Frank, you want to begin with your closing statement? Okay, gentlemen, y'all want to close out? I think you've got, what, 6 minutes for a closing statement? I think you used 4 beginning. Okay, so you have 6 minutes. You have 1 minute. I'm sorry, 1 minute. Okay, so you do have 6.
Thanks. I'm not going to need 6 minutes. I want to first thank everybody for coming out tonight. I appreciate y'all's interest. We appreciate the opportunity to be here in front of you. There'll be other meetings that are called, some by the concerned citizens and some by us. We're also going and seeing all the civic clubs and the different organizations, trying to spread the word as best we can. We wouldn't be here doing this as volunteers unless it was necessary. We have some of the best doctors and the best nurses anywhere on the planet. Now, ER's a lightning rod. I get that. ER is always a lightning rod. You know, you get the right doctor. I had somebody text me last week, went in for an eye abrasion. He said, I just want to tell you that, I don't remember her name, that Dr. So-and-so is a rock star. She took great care of me, communicated the whole time. It was wonderful. So not everything is the gloom and doom you hear. ERs are tough. We built this hospital based upon consultants, architects, HUD's input, the board of directors. We did the best we could. There's a dramatic change in healthcare. From the time that we started raising funds for the foundation, that I still proudly serve on, it has changed dramatically. So outpatient care, reductions from reimbursement, Medicaid and Medicare changes. Some folks call it Obamacare, it's the Affordable Care Act. It changed the way healthcare is provided. So yes, could we do things differently? I wish I had that 20/20 hindsight to be able to go back and say, let's only build for 30 or 45 beds. This was what the experts said at the time. So we can't litigate the past. We can't go back and change it. It is what it is. So we're asking for 10 cents per $100 valuation. On the average, that's the way the state statute requires it to be written. So on an average home in Fayette County, that's about $175 a year. By 12 months, it's $14 and change a month. By 365 days, what's the math on that? 48 cents a day. So we're not asking for an open checkbook. We're saying that's what we want. The district board will set that. We're just recommending the 10 cents, but the district board gets to set that. And that's what we're asking for. We've got great doctors, and we're asking for 10 cents per $100 valuation. I thank you for your time. The people get to vote. The people get to take this hospital back into their own control with this vote on June 13th. Yep, it's illegal, but the people get it. It's like we elect our judges, our county commissioners, our mayors, our city council people. Why not elect the board of your hospital in this community? Thank you all for your time.
Okay. Again, thank you all for attending tonight. We hope you gained some insight into the issue and eventually can make an informed decision on the proposed hospital district tax. That was our goal. However, we continue to feel that the board is not being completely transparent on many issues associated with their proposal. They've said they have a plan. They do. But then they also didn't tell you tonight, which they told us last week, that the new board can totally disregard that plan. So we've been told several times that everything's up to the new board. All of the decisions, all of the plans, everything is up to the new board. And we know that the new board is going to be appointed by our county commissioners out of the local residents within their precincts. I heard it said tonight that, oh yeah, there's a lot of expertise out there, and some of those people are willing to serve. But again, we've given this hospital a chance. They've had chances with multiple boards. They've had chances with management companies, and it hasn't worked. Throwing good money after bad by starting over with a new board pulled out of the local residents, I don't think it's going to change anything. Also, a lot of the information that's being put out in their brochures, like Michael just talked about, 10 cents, 10 cents, 10 cents. If you read the ballot language, it says a maximum of 25 cents. So, given a choice, a new board wants to make it work, what are they going to do? They're going to get as much money as they possibly can. That gives them a better chance of making the hospital work. So these figures of, oh, it's only $150 a year. $150 a year on what lowball value are we talking about? So anyway, another of the scare tactics that are in their brochures, talking about employees losing their jobs and leaving the community and all of that. Think about the surrounding cities and counties that have medical facilities. These employees could easily get other jobs in other locations. So maybe they'll have to drive another 20 minutes or 30 minutes. But who out here has not had to do that in the past? I know I certainly did when I worked. So anyway, I'm not going to belabor the fact. I think we had a good conversation tonight. There was a lot of good questions that came up. If you're like me, this isn't a good idea, but I'm going to leave it at that. Just hoping that y'all talk to your friends and neighbors and let them know what you heard here tonight. For those that couldn't attend, remind them that there will be another meeting next Wednesday night at the Schulenburg City Council Chambers, and then the following Wednesday on the 29th at the Fayette County AgriLife Building in LaGrange. So again, thank you for your attendance. Oh yeah, we got signs over there. And we do take free will donations. So thank you again for attending. Good night.
Ryan Fairbanks. Before we leave tonight, I'd like to extend to Mr. Corporal, Dr. Juno, Mr. Lee, This particular group have had their discussion here. I'd like to invite them to come work with me to the Ellinger Community Center, and also if they want to like the whole meeting, more than welcome. Thank you.